Hello, today we will discuss Viva questions on middle part of norma basalis. So the first question is, this vomer bone, it articulates with the sphenoid, that is the body of sphenoid. So which joint is formed between the ala of vomer and sphenoid bone? So the answer is syndialysis. Syndialysis type of joint is formed between the ala of vomer and the body of sphenoid. Now another question is, which structure pass through the vomerovaginal canal? See, here you can see this is the ala of vomer bone, and here this one is the medial pterygoid plate. So this medial pterygoid plate, it gives vaginal process here. So here these two processes they overlap, that is the vomer, it means ala of vomer, and the vaginal process of medial pterygoid plate. So here a foramen is formed. This canal is known as the vomerovaginal canal. So which structure passes through this vomerovaginal canal? So pharyngeal nerve from the pterygopalatine fossa, it passes through this vomerovaginal canal. Now another canal, that is palatino-vaginal canal. So which structures pass through the palatino-vaginal canal? See, here you can see this is, we are talking palatino-vaginal. It means this one is the hard palate. So this palate, it gives this sphenoidal process, and vaginal, that is the vaginal process of this medial pterygoid plate. So they overlap and they form antero-posteriorly directed groove. So this canal is known as the palatino-vaginal canal. Palatino-vaginal canal. So which structure passes through this palatino-vaginal canal? So we have pharyngeal branch from the pterygopalatine ganglion. It passes through this palatino-vaginal canal. This structure attaches on the pharyngeal tubercle. So here we have an attachment of a raphe, that is the superior upper fibers of superior constrictor muscle of pharynx. It is attached on the pharyngeal tubercle. Now attachment of medial pterygoid plate. See, this is medial pterygoid plate. This fossa, it is known as the scaphoid fossa. So this scaphoid fossa, it provides principal attachment to tensor veli palatini muscle. Then this whole posterior free border of medial pterygoid plate, it provides attachment to a fascia, that is pharyngobasilar fascia. This projection, it is known as the pterygoid hamulus, and this pterygoid hamulus and posterior border provides attachment to the upper fibers of superior constrictor muscle. So both are the part of the pharynx. And then here this pterygoid hamulus have a raphe which is attached to the mandible. So it is known as the pterygomandibular raphe. Now attachments on lateral pterygoid plate. So this one is the lateral pterygoid plate. It has two surfaces. This surface is known as the medial surface, and this surface is known as the lateral surface. So on lateral surface we have attachment of lower head of lateral pterygoid muscle, and on medial surface we have attachment of medial pterygoid muscle. Now this medial pterygoid muscle, it has two heads. So this surface provides attachment to deep head of medial pterygoid muscle, and superficial head, that is from this maxillary tuberosity. Now attachment on pterygospinous process. Now here you can see this is the lateral pterygoid plate. So this free margin of lateral pterygoid plate. Now here in the middle of this free margin of lateral pterygoid plate, here a projection is there, that is known as the pterygospinous tubercle. So from the pterygospinous tubercle to this spine of sphenoid, this is spine of sphenoid, this is sphenoid bone. So just behind this foramen spinosum we have a spinous projection, that is known as the spinous process. So here we have a attachment of the ligament, the name is the pterygospinous ligament. This structure lodges in the sulcus tubi. Now see, here you can see this one is the greater wing of sphenoid. In greater wing of sphenoid we have this foramina, this is foramen oval, then foramen spinosum, and here you can see this one is the petrous temporal bone. So a line of articulation between the greater wing of sphenoid and petrous temporal bone, we have this groove. This groove is known as the sulcus tubi. So in this sulcus tubi we have a cartilaginous part of auditory tube. Now structure passing through the foramen oval. Here you can see this is the greater wing of sphenoid, and in this greater wing of sphenoid we have an oval foramen, that is known as the foramen oval. So structure passing through this foramen oval are, you can remember it, as male, M-A-L-E. M stand for the mandibular nerve, A stand for accessory meningeal artery, L means lesser petrosal nerve, and E means emissary vein. Here emissary vein, it connects the cavernous venous sinus. You know the location of the cavernous venous sinus. So here we have a cavernous venous sinus. So it communicates with the cavernous venous sinus and the pterygoid venous plexus. Which structures pass through the foramen spinosum? Here you can see this is foramen oval. So posterolateral to the foramen oval we have foramen spinosum. You can remember it as M3, that is middle meningeal artery, middle meningeal vein, and meningeal branch of mandibular nerve, that is nervus spinosum. They pass through the foramen spinosum. Now attachment of spine of sphenoid. So here you can see posterolateral to the foramen spinosum we have a spinous projection, that is known as the spine of sphenoid. So it provides attachment to 2 muscles and 3 ligaments. Muscles are tensor belli palatini and tensor tympani, and 3 ligaments, they are sphenomandibular ligament, then pterygospinous ligament, and anterior ligament of malleus.